A placebo-controlled double-blind add-on study of ginseng in opioid withdrawal syndrome.
Hello, thank you.
Please.
Hello, I'm who conducted this study titled the Placebo-Controlled Double-Blind Add-on Study of Ginseng on the Opioid Withdrawal Syndrome under the supervision of Dr. Farshad Hashemian. New advancements in the field of addiction are always on the horizon. Easing withdrawal symptoms, especially in the intention of a treatment, can help us to facilitate a safe transition while, and more important, to prevent relapses. This is the first clinical trial observing effects of ginseng on withdrawal symptoms, but pharmacological studies suggest that ginseng total saponins have inhibitory effects on CAMP pathway and also will modulate voltage-sensitive calcium channels. As a whole, the results suggest that ginseng total saponin may be useful in reducing withdrawal syndrome. And as a clinical trial was missing, we performed this randomized double-blind placebo-controlled study in patients under MMT protocol. Our patients in drug group received 2 capsules of ginseng equal to 500 mg of this drug every 15 first day of their MMT treatment, and patients of placebo group received 2 capsules of placebo every 15th day of their MMT protocol. As you see, we followed 18 patients in each group. The clinical opioid withdrawal scale was filled for each patient at the baseline and the first, 7th, 10th, and 15th day of their treatment to assess abstinence symptoms. And also, we recorded methadone dosage every 15th day of their treatment. Our patients were all male, aged between 18 to 50 years old, and we selected the ones who had been addicted to opiate for at least 1 year, and it was the first day of their MMT treatment. We excluded the patients who had any allergic reaction to our drug or other ingredients of our placebo, and other exclusion criteria were positive urinary tests indicating relapse and use of any kind of substances, using any kind of medication which could interfere with symptoms of withdrawal, as NSAIDs or benzodiazepines, missing 1 dose of our drug or a day of their MMT treatment. Results. As you see, there was no significant difference between patients of 2 groups regarding social demographic variables. Also, baseline symptoms of withdrawal was not significantly different between patients of 2 groups. This diagram displays total score of clinical opioid withdrawal between patients of 2 groups. As you see, ginseng group experienced slighter symptoms on assessed days, but although it was not significantly different between 2 groups on assessed days. This is an important finding in our study which demonstrates methadone dosage received or better needed by the patients of the 2 groups. As you see, ginseng group received significantly lower methadone dosage from the 5th day of the trial to the end. So, patients in ginseng group experienced approximately the same levels of withdrawal symptoms in comparison with placebo, but with lower methadone dosage. And we suggest that pre-treatment with ginseng 1 or 2 weeks before cessation of an opioid can reduce tolerance to methadone, so the patient doesn't need higher methadone dosage to achieve similar effects, and screening methadone blood levels can help us to rule out the possible pharmacokinetic effects of ginseng and methadone. Thank you for your attention.